What if the next time you visit the hospital emergency room, you're asked questions about whether you've had a gun pulled on you recently? A doctor and Toronto native is developing a screening tool that asks these types of questions with the hopes of helping to reduce gun violence south of the border. But could it work here, where despite the pandemic, gun violence rates remain alarmingly high, most recently claiming the life of a 12-year-old boy?
Seeing innocent children being killed by stray bullets is heartbreaking, to say the least. And, when I left Toronto, I initially trained in Chicago, and I was pulling bullets out of babies all the time, and it was just shocking.
Dr. Chetan Sathya is the director of the Center for Gun Violence Prevention at Northwell Health in New York State. He, like many health experts, sees gun violence playing out as a public health crisis.
Over and over again, we as physicians are having to tell parents that their children have died from a preventable disease.
Sathya believes hospitals have a role to play in preventing it. He recently received a U.S. federal grant to develop a universal screening tool to assess a patient's risk for bullet injuries. He hopes this will significantly reduce the number of shooting victims south of the border.
So when a patient comes into the hospital, either via a tablet or the nurse is just asking questions, they're going to be screened for firearm access and gun violence risk using a special score. And then depending on the score that they get, they'll get appropriate resources.
The questions will be along the lines of, have you had a gun pulled on you in the last 6 months? And have you recently heard gunshots in your neighborhood? Patients can then be referred to counseling or community services based on the risk. The pediatric surgeon who did his residency at the University of Toronto believes a tool like this could also be helpful here at home, where gun violence rates climb higher than many U.S. cities. The violence in Toronto hasn't slowed amid the pandemic. The most recent stats from Toronto police show that there have so far been at least 425 shootings this year, on par with last year's numbers. At least 37 people have died this year, and so far, at least 164 people have been injured. The city's hardest hit neighborhood is around Jane and Finch. Community advocate Sam Tekle says one of the biggest barriers to effectiveness for a tool like Dr. Sathya's is trust. To many, he says, a hospital is not a safe space. Those who are shot may not even go to ERs, fearing interrogation and police involvement. And he says there is a history of systemic racism.
They're not exactly the most comforting places for Black and racialized folks, actually. And there is actually racism that happens in the hospitals that don't make these places of care, and also not trustworthy to share some of the kinds of information the doctor is hoping to ask.
Dr. Sathya says he recognizes those barriers, and part of the research right now is figuring out how to address them. The screening tool is set to roll out early next year in 3 emergency departments in the state of New York. And once the data starts rolling in, they'll be able to measure just how effective this is. In downtown Toronto, Natividad, CityNews.
This kid obviously doesn't understand the rule and nature and the culture of Canada. Okay, he wants to be violent and bring that violence with him.